Hello students. Welcome to chapter assessment of the hematologic system. This is your Nurse 201 class. So the key terms are that we need to be familiarized are blood stem cells, and specialized and differentiated cells that are capable of becoming any type of blood cells. So blood stem cells are coming from embryo or adult stem cells. When are coming from embryo are called pluripotent. Okay, and we are going to see that in the diagram that we have ahead. Then you know already the meaning of clotting. Erythrocytes, mature red blood cells. Erythropoiesis is a selective growth of the bone marrow stem cells into mature erythrocytes. Fibrinolysis, the process that dissolves fibrin clot agents with special enzymes to prevent overenlargement of a clot beyond the area where it is needed. Hemostasis, the multiple step process of controlled blood clotting, resulting in localized blood clotting in damaged blood cells to prevent excessive blood loss while continuing blood perfusion to all other areas. Perfusion, the total arterial blood flow through the tissues, peripheral perfusion, and blood that is pumped from by the heart, central perfusion. So remember, the blood coming from the heart to the tissues is coming from the aorta. Okay, so aorta starts with the letter A. The base of the letter A, the two little legs of the letter A can be converted into arrows. Okay, so that you know that the blood is going down. The arrows means the blood is going down. Aorta, the second letter is an O, so aorta oxygenated, O oxygenated. Okay, that's a trick. And then the vein is a V, as in Victor, and then the little legs of the V are going up, so those are converted into arrows and means that the blood is coming from down to up. And of course, if the aorta delivers oxygenated blood, the blood coming from the veins is deoxygenated. Okay. Petechiae, reddish purple pinpoint hemorrhagic lesions of the skin. And we know the erythrocytes are from red bone marrow. So the most important concepts, clotting and perfusion, the hematologic system. It's very important that we need to master this concept. Okay, perfusion is the total arterial blood flow from the tissues, peripheral perfusion, because go to the peripheral areas of the body, and blood that is pumped by the heart, central perfusion. It's called central perfusion because it's the heart. Clotting is a complex multi-step process by which blood forms a protein-based structure in an appropriate area of tissue injury to prevent excessive bleeding while maintaining whole body blood flow perfusion. Bone marrow. We know that the bone marrow, the cell producing part of the bone marrow in adults is present only in flat bones. I want to remark this. I want you to remember this, that the bone marrow producing the factory of the stem cells are in sternum, skull, pelvic, and shoulder girdles, and the ends of long bones. With aging, fatty tissue replaces active bone marrow, and only a small portion of the remaining marrow continues to produce blood in older adults. Bone marrow first produces immature blood stem cells, which are unspecialized and differentiated cells that are capable of becoming any type of blood cells depending on the body's needs. And nowadays, this is very popular. Treatments with blood stem cells coming from the bone marrow are used to treat different types of conditions like diabetes, or maybe even people that are suffering from blindness, rheumatoid arthritis. You mean it's even there are studies that are being conducted for cancer with these blood stem cells. Erythropoietin is a growth factor specific for the RBC. Growth factors control WBCs and platelet growth. Blood component. So for this blood component part of this lecture, let me play a video to make it easy. 1, 2, 3. Okay, let's watch this video.
The heart supplies blood to the body. Blood carries important materials which are required for the body to function and to keep healthy. These include nutrients and oxygen. Blood also helps to get rid of waste and carbon dioxide from the body, as well as fighting infections. Blood is transported around the body via blood vessels. The components of blood are red blood cells, white blood cells, platelets, and blood plasma. The proportions are 45% red blood cells, around 1% white blood cells and platelets, and 55% plasma. Let's begin with red blood cells. Red blood cells are also known as erythrocytes. These are produced in the bone marrow. They carry oxygen and nutrients. They contain a protein called hemoglobin. Hemoglobin helps to carry oxygen from the lungs to the rest of the body. This is what makes blood red. Carbon dioxide is then returned from the body to the lungs to be exhaled. White blood cells. White blood cells are nucleated cells, also known as leukocytes. They fight infections to keep us healthy. So when you get sick, it's the production of white blood cells that helps you fight the cause of your illness. Platelets. Platelets are also known as thrombocytes. These are fragments that help to stop bleeding and help to heal wounds by forming blood clots. Red blood cells, white blood cells, and platelets are carried in a yellow liquid called blood plasma. Blood plasma contains mainly water and other useful and waste products. It contains proteins and hormones which help with the body's functions. Plasma also helps to regulate bleeding and clotting.
Thank you so much. This was a great video and a good refresher because we need to refresh this knowledge. As you see, the most important component in blood is RBCs. Okay, so in plasma we have albumin, globulins, and fibrinogen. Okay, red blood cells, erythrocytes are the largest portion of blood. We know that. Mature RBCs have a biconcave disc shape and no nucleus. And this is good to know. Pay attention every time that I say it's good to know. It's possible that you are going to see this in the exam. Together with a flexible membrane, this feature, the fact that it's biconcave and has no nucleus, follow RBCs to change their shape without breaking as they pass through narrow. Okay, so that's good to know. RBCs, okay. Biconcave shape means unbreakable, meaning increases lifespan. Okay, increases lifespan. So the number of RBCs an adult has varied with gender, age, and general health. Health mature circulating RBCs have a lifespan of about 120 days. 120 days. Okay, the RBCs produces hemoglobin, and hemoglobin is the one that gives the color to RBCs. okay, because that color comes from heme in hemoglobin. That's why they are red. That's why when people is having anemia, you see that they are losing color, okay? Iron is an essential part of hemoglobin because iron is the cellular substance to which oxygen binds. Each complete hemoglobin molecule can transport up to 4 molecules of oxygen. Okay, so RBCs, 120 days lifespan, hemoglobin on it, giving the color, and also iron present there. So we have this diagram. I want you to be very, very familiarized with this diagram because we are going to come back to it probably to understand the anemias. So here we have the pluripotent stem cells. Those are coming from the embryo, okay? And then when the baby is born, delivered, then we have committed myeloid stem cells. Committed means that the cells are having a new mission. Both types are part of your body defense, okay? So you have the committed myeloid stem cells that is coming from the marrow, and you have the committed lymphoid stem cells coming from the lymph node, the lymphatic system. So now they are subdivided. The committed myeloid stem cells is the platelets, the erythrocyte, as we mentioned, because it's coming from the marrow. Myeloblast is going to produce macrophage, which are the cells that start eating any residuals from any bad cells that have been destroyed. Then you have the promyeloblast that are going to produce basophils, eosinophils, and neutrophils. Neutrophils are white blood cells. Eosinophils can help us to check for allergies. And then we have the committed lymphoid stem cells, which produces the T lymphocyte, the natural killers, and the mature B lymphocyte. This is basically the immune system. So both the T and the B cells makes protein called antibodies to fight pathogens, right? These cells protect you by destroying harmful pathogens by sending signals that control your immune system response to threats. That's the marvelous, the great part of the T cells and the B cells. They express activation receptors that recognize virus infected cells, highly related to receptors recognizing tumor cells. The activation receptors trigger cytotoxicity and cytokine production. Okay, very good. And then the most important feature of hemoglobin, talking again about the hemoglobin, is the ability to combine loosely with oxygen. That's very important. So we have the RBC production. Erythropoiesis is coming from the marrow. And we know that the RBC helps with tissue perfusion and help us with the adequate delivery of oxygen. The kidney produces the RBC growth factor erythropoietin. We know that at the same rate as RBC destruction or loss occurs to maintain a constant normal of regulated RBCs. So as many RBCs are dying, many RBCs are produced by the kidney through the erythropoietin growth factor. When tissue oxygen is less than normal, and that is the hypoxia, the kidney releases more erythropoietin, which then increases marrow production of RBCs. When the tissue oxygen level is normal or high, erythropoietin level falls, slowing RBC production. Okay, many substances are needed to form hemoglobin and RBC, including iron, vitamin B12, folic acid, copper, pyridoxine, cobalt, and nickel. I just want to mention it's very important to have the RBC in the range level, in the normal range level, because those are the most cells, in our blood, from the blood component. As we saw in the video, 45% of the blood is RBCs, right? That help us with the color, with the oxygen, Okay, and they are produced with iron, vitamin B12, folic, la 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 la. So B12, let's do an introduction. We are going to speak about this more in detail in the next chapter. Um, it's produced with the intrinsic factor binds to B12, right? After attaching, intrinsic factor and B12 travel to the intestines to be absorbed into the bloodstream. Vitamin B12 is needed for red blood cells to form and grow. We know that B12 is important to develop RBCs. Pyridoxine is B6, is another type of vitamin B. Um, and this is good to know. I want you to know, are we talking about white blood cells? Not yet. Okay, so a lack of any of these substances can lead to anemia, reduces number of function of RBCs. So folate is not only good for pregnant women, okay, or you have to check your folate levels as an adult to make sure they are good, because you need to be producing regular RBCs, okay? This is a misconception in primary care doctors. Sometimes they only prescribe folate for a pregnant woman or for a woman that is within the period that they can become pregnant. We need to still get in folate, okay, during adult times to produce good RBCs. White blood cells, and this is good to know, is another good to know is here, also are formed in the bone marrow. We know that. That many types of, the many types of WBCs have all specialized functions that provide protection through inflammation and immunity. Something that I want you to remember is that neutrophils within, we have different types of white blood cells. We have neutrophils, lymphocytes, monocytes, eosinophils, and basophils, right? As we saw in the diagram. Okay, so a good way to remember the order, okay, and the percentage is this mnemonic: nurses love to monitor. Remember, nurses, N stands for, is going to represent the neutrophils, love is going to represent the lymphocytes, and monitor is going to represent the monocytes. So if you remember, nurses love to monitor, you know that the neutrophils are 40 to 70%. That's the most amount of neutrophils within the white blood cells army. Then you have the love. Love is lymphocytes 20 to 44, and then monitor is monocytes 2 to 11%. Eosinophils and basophils are at the end of the list. Okay? Okay. So you see pluripotent cell, committed. We spoke about this. Let's move forward. Platelets, also called thrombocytes, are the third type of blood cells. They are smaller blood cells formed in the bone marrow from megakaryocyte precursor cells. When activated, platelets stick to injured blood vessel walls and form platelet plaques that can stop the flow of blood at the injured site. Platelets help keep small blood vessels intact by initiating repair after damage. Production of platelets is controlled by the growth factor thrombopoietin. So for red blood cells, it's erythropoietin. For platelets, is thrombopoietin. Accessory organs of blood production, the spleen and the liver, are important. Impaired hematologic function, which usually decrease adequate perfusion or clotting to some degree. The spleen contains three types of tissue: white pulp, red pulp, and marginal pulp. And you're welcome to read this definition to be more familiarized and to master, right, the concepts. Anyone who has had a splenectomy has reduced immune functions and an increased risk for infection and sepsis, okay? Because the white pulp, for example, is the area that is basically producing antibodies, okay? Also, bacteria and all RBCs are removed in this part of the spleen. Red pool is a storage site for RBCs and platelets. Marginal pulp contains the ends of many blood vessels. So the liver produces prothrombin, okay, prothrombin. And vitamin K in the intestinal tract, vitamin K is needed to produce clotting factors, factors 7, 9, and 10, and prothrombin. The liver also stores extra iron within the protein ferritin. And we're gonna see a video in a few minutes about the ferritin, the iron, the transferrin, all these different terms. Hemostasis and blood clotting. Hemostasis is the multi-step process of controlled blood clotting, resulting in localized blood clotting in damaged blood vessels to prevent excessive blood loss while continuing perfusion or liquid blood and individual cells to the other areas. Hemostasis starts the formation of a platelet plaque and continues with a series of steps that eventually cause the formation of a fibrin clot. Platelet aggregations begin forming a platelet plaque by having platelets clump together, a process essential for blood clotting. So whenever there is bleeding, all these steps are taking place in order to have a hemostasis. 3 platelet plaques are not clots and last only a few hours. Okay, so these platelet plaques are not clots, but they last a few hours just to be under hemostasis. Thus, they cannot provide complete hemostasis because they are there only a few hours. Substances that activate platelets and cause clumping include adenosine diphosphate, is the ADP, calcium, thromboxane A2, and collagen. Substances that activate platelets and cause clumping, including, and I want you to remember calcium. That's very important to remember, and also collagen. Okay, so don't take calcium and collagen in excess because you can promote clumping. Blood clotting is a cascade triggered by platelet aggregation, the formation of a platelet plaque. We know that. Normal blood clotting is triggered initially by the extrinsic clotting pathway outside the blood vessels and the intrinsic clotting pathway. So they are processed outside the blood vessels and processed inside the blood vessels. The most common extrinsic event is trauma that damages blood vessels and exposes the collagen within vessels walls. Collagen then activates platelets to form a platelet plaque within seconds. Other conditions and substances that can activate platelets in extrinsic pathways include inflammation, bacterial toxin, or the presence of foreign proteins. Okay, this is important to remember. Triggering of the intrinsic pathway occurs through more internal conditions such as impaired blood flow, venous stasis. That's why it's so important after surgery to promote ambulation on the patient to prevent venous stasis. It's important also that we walk and exercise and don't be seated extended periods of times to prevent thrombosis, right? Even if we don't have a surgery, we don't have a trauma, we can get into this state. Clotting factors are inactive enzymes that become activated in sequence. The last 2 critical steps in the cascade are the activation of thrombin from prothrombin and the conversion by thrombin of fibrinogen into fibrin. Only fibrin molecules can begin the formation of a true clot. Clotting factors. Fibrinolysis is a process that dissolves fibrin clot agents with special enzymes. So lysis means the destruction, right? We have to be familiarized with those suffix and presuffix so we can understand. The process starts by activating plasminogen to plasmin and an active enzyme, then digest fibrin, fibrinogen, and prothrombin, controlling the size of the fibrin clot. Even though I am not testing you guys on this, which is more for the, is to be used more and understood more for doctors, and it's part of your, probably your anatomy and physiology that you study before. It is good as a refresher to have this into consideration. Hematologic changes associated with aging. Remember that the NCLEX is basically what you are doing to prepare the patient for a procedure, your safety considerations, post-procedure care. You need to be familiarized with the care for different ages, like we are going to study right now with the aging population. And basically, you need to know what is the procedures about, but you don't need to be an expert. And remember all these steps within the procedure. Hematologic changes associated with aging. The older adult has an increased blood volume with lower levels of plasma protein, decreased blood volume with lower levels of plasma protein, because the marrow, when we age, starts producing less of these cells. The lower plasma protein level may be related to a low dietary intake of protein and to reduce protein production by the older liver as well. Okay? As bone marrow ages, it's producing fewer blood cells, as I said. Total red blood cells and white blood cells counts are lower among older adults, although platelet counts do not change. So when we are having a district in the hospital and we are reviewing the blood results, right? Don't get in panic if you see low RBCs and WBCs. If you have an older patient, this is part of the aging process. However, you need to consider other factors, right? Depending on the condition of the patient. Lymphocytes becomes less reactive to antigens and lose immune function. Antibody levels and responses are lower and slower in older adults. The WBC count does not rise as high in response to infection in older adults as it does in younger adults. Hemoglobin levels in men and women fall after middle age. Okay, so your 30 to 40s start the hemoglobin going. Okay, iron deficiency diets may play a role in this reduction. So we have the older adult considerations. Please review this. Make sure you know about the pallor, the absent hair in the trunk or extremities, because this is related to perfusion. How is the skin? Okay, do not use skin moisture as a reliable indicator of an underlying hematologic problem in the older adult. Okay, let's continue. In our assessment, nursing assessment, patient history, let's consider that women have lower RBC counts than men in general. This difference is greater during menstrual years because of menstrual blood loss, of course, and faster than blood cell production. So you lose more blood in the menstruation than the production that is done in the body. This difference also is related to blood dilution caused by fluid retention from female hormones. And that happens a lot during the perimenopausal ages and menopausal ages. Women are retaining a lot of fluids, so the dilution causes this effect. Always assess for RBC adequacy in a woman hospitalized for any reason. Liver function, the presence of known immunity or hematologic disorders, current drug use, dietary patterns, and socioeconomic status are important to assess, because the liver is important in producing clot factors. Ask the patient about the symptoms that may indicate liver problems, such as jaundice, anemia, and gallstones, that are stones in the gallbladder. Previous radiation therapy for cancer may impair hematologic function if marrow-forming bones were in the radiation path. Meaning, if a patient was having radiation, let's say for ovarian cancer, and the ovarian cancer is close to the marrow, right? Is in the back, is close to the iliac crest, where the bone marrow aspiration and biopsy is conducted. This is the one of the areas where the RBCs are produced. Then is going to cause a lower production, sometimes very low in WBCs. I've seen patients after radiation getting a 0.4, 0.6 average in the normal range of WBC, and you should be familiarized with your WBC range. So the clotting factors, you have the whole list. As I mentioned, I want you to pay attention to calcium, enhances platelet aggregation and makes red blood cells clump together. Factor 7 activates factor 9 and 10, which are essential in converting prothrombin to thrombin. Synthesis is vitamin K dependent. Okay, and let's refresh. Our vitamin K plays an important role in blood clotting and bone straightening. Okay, not too many students know this relation with bone straightening. They remember the blood clotting fact. Vitamin K helps with blood clotting by making 4 of the 13 proteins needed for blood clotting, producing proteins that are essential for blood clotting, acting as a cofactor for a group of proteins known as vitamin K dependent clotting factors 2, 7, 9, and 10, which are involved in the activation of blood clotting proteins. Warfarin equals blood thinner, vitamin K counteracts, and we know this. Just to somebody asked me in the previous semester, where can I get the version of this electronic books with all these facts and extra information? I developed this for you guys. Okay, I spent a good amount of time developing every chapter and adding this extra information for you to be to have this available. Ask about the patient occupation and hobbies and whether the home is located near the industrial setting. This information may identify exposure to agents that affect bone marrow and hematologic function. And this makes me remember that movie Erin Brockovich from, I think it's Julia Roberts. She was Julia Roberts, right? The same actress that was in Pretty Woman. She had a movie called Erin Brockovich, where they discover the water was having a lot of chemicals, and people around that particular town was getting a lot of cancer and diseases, right? So ask the patient about the use of anticoagulation agents and NSAIDs, which change blood clotting activities. So your ibuprofen, your Motrin, your naproxen, right? Your NSAIDs. So there is an example of drugs impairing the hematologic system. In the first column, we have drugs causing bone marrow suppression, and of course, the chemotherapeutic agents. Colchicine, this is a medication that is for gout. Okay, that causes bone marrow suppression. Glanciclovir is one of the antivirals that is used to treat herpes. So there is another vanaciclovir, aciclovir, okay? So those causes bone marrow suppression. So it's better to you to prevent the herpes and the gout. Drugs causing hemolysis, amoxicillin, which is a very well-known antibiotic, glyburide, a medication that treats diabetes type 2, methyldopa, which is known as Aldomet to treat hypertension, penicillin, another antibiotic, sulfonamides, more antibiotics from the family of the sulfas. Vitamin K causes hemolysis. Okay, so don't take too much vitamin K. Drugs disrupting platelet actions, and actually vitamin K is a homework for you. I'm not testing you in this, but try to analyze what food is full of vitamin K so you can select and try to pay attention more of these foods to be included in your diet. Okay, you don't want to have hemolysis. Drugs disrupting platelet action, your aspirin, and that's good to know. Aspirin salicylates interfere with platelet function and can lead to petechiae and ecchymosis. And we know that petechiae are those little dots, red color, sometimes purple, that appears in the body, petechiae. Valproic acid also disrupt platelet action, is an anticonvulsant. Okay, very good. So you have your NCLEX examination challenge 36.1. I want you to pay attention to these questions. For example, you can see that the answer is already there. If you don't know the answers, you go here in your electronic books and go all the way down and you find NCLEX examination challenges answer key, and you can figure out the answer. The same thing for the mastery question answer key. That is, the mastery questions are at the end of every chapter. So then nutrition status is something that you need to assess. Possible iron, protein, mineral, or vitamin deficiencies, diets high in fat or carbohydrates and low in protein, especially our patients that are vegan, right? Because they can develop different types of anemia. Diets high in vitamin K found on leaf green vegetables may increase the rate of blood clotting, and also chronic alcoholism causes nutrition deficiency and impairs the liver, both of which reduce blood clotting. So let me start with this. A healthy lifestyle includes no alcohol, because depending on how your organs are working, the alcohol could be absorbed faster and causes more damage. Okay, so if you don't know the status of your body, if you are developing any chronic condition, the intake of alcohol can worsen that condition. So it's better, do not consume alcohol, do not smoke. You see, it's good to have a healthy amount of protein, good protein, organic protein, please. And let's continue. Family history and genetic risk. Blood clotting are inherited. Blood clotting are inherited. Okay. As whether anyone in the family has had hemophilia, frequent nosebleeds, postpartum hemorrhage, excessive bleeding after tooth extraction, or heavy bruising after mild trauma. As whether any family member has sickle cell disease or trait, although sickle cell disease is seen most often among African American, anyone can have the trait. We are going to speak about sickle cell more detail soon. Current health problems. We are in the assessment part. We are asking about nutrition. We are asking about if they are living with somebody, what type of diet. Lymph nodes, swelling, excessive bruising, bleeding was spontaneous or induced by trauma. All these facts we need to assess to see if there is any risk for bleeding, right? Bleeding after routine dental work. How is the menstrual cycle? If you have clots when you menstruate. Also ask for shortness of breath on exertion, palpitation, frequent infections, fever, recent weight loss, headaches, and paresthesias. Paresthesias are pins, needle sensation, okay? Some nurses, they don't understand when we speak with the proper terms. Paresthesias are pins, needle sensation. So I want to say something. Let's follow critical thinking. If we have low RBCs that are containing hemoglobin, and we know hemoglobin helps with the oxygen delivery, if we have low volume of RBC in the blood, now Of course, we are going to have shortness of breath because we are lacking hemoglobin and oxygen, okay? And palpitations, why palpitations are going to develop? Because the heart is in the habit of pumping certain amount of fluids and blood, right? If we have low pressure, low pressure in the vessels, the heart is going to start pumping faster because they want to deliver. The heart is going to say, it is my mission to deliver certain amount of cc, certain amount of volume to the organs. So how can I deliver that amount per minute? By pumping faster if the volume, the blood is reduced. Okay, that's why they have palpitations. Frequent infections, fever, recent weight loss, headaches, and paresthesias. Okay, the most common symptom of anemia is fatigue as a result of decreased oxygen delivered to cells. That's the most common symptom, anemia. Cells use oxygen to produce the high energy chemical ATP, and we know that from anatomy and physiology. I'm sure you know that. That's one of the basics terms and concepts in energy production needed to perform most cellular work, right? Determine whether other symptoms of anemia, such as vertigo, tinnitus, and sore tongue, are present. Sore tongue pain results from infection and inflammation. Okay. Okay. So you have another NCLEX question, and this is good to know. This question is killing three birds in one shot. So which client history information is most relevant for the nurse to document when assessing for a possible hematologic problem? Possible hematologic problem. It's a vegan diet. A patient is eating a vegan diet. Yes, can cause a B12 deficiency, right? Mother has pernicious anemia. Pernicious anemia B12 is an autoimmune disease. Sometimes in rare cases, I am not saying it happens all the time. In rare cases, they could be inherited. They could pass these autoimmune conditions through families. So that is a consideration in this particular question. Sprays fertilizers and weed killers for a lawn care company. Not only the fertilizers, but the pesticides. I have patients that I'm treating with leukemia, and a specific type of leukemia. Leukemia has 4 types, but the LLA patients, most of them, but the others can get to. But most of them are because they are using a lot of pesticides. Okay, this type of sprays at home, they see one roach at home and they get cuckoo, and they think the whole house is infected, so you start spraying all over and putting, okay, and this can cause leukemia, believe it or not. Okay, okay, let's continue. Physical assessment, skin assessment, inspect the skin and mucous membrane for pallor or jaundice, nail bed for pallor or cyanosis. It's all about oxygen, okay? It's all about oxygen and the color and hemoglobin. So the jaundice, the pallor is related to hemoglobin. The cyanosis is related to the oxygen, and that's good to know, okay? Um, Petechiae, a reddish purple pinpoint hemorrhage, lesions in the skin. Bruises may cluster together. For hospitalized patients, determine whether there is bleeding around nasogastric tubes, endotracheal tubes, central lines, peripheral IV sites, or Foley catheter. That's good to know. It comes another one. The tongue is smooth in pernicious anemia, right? And iron deficiency anemia, or smooth and beefy red in other nutrition deficiencies. That's good to know. Another one that's good to know, pallor and cyanosis are more easily detected in adults with darker skin by examining the oral mucous membrane and the conjunctiva of the eye. This particular fact came in the quiz, right? The question, one of the questions of the quiz. Inspect and palpate all lymph nodes area, okay? Respiratory assessment. When blood problems reduce oxygen delivery, the lungs work harder to maintain tissue perfusion. Walking 20 steps in 10 seconds knows whether the patient can complete a 10-word sentence without stopping for a breath. That's an excellent assessment. It's so easy to assess somebody. You can even ask somebody to sing for you a small part of the song, and you will see if that person is having enough breath to complete that particular song or a sentence. You can ask a patient, please, can you read this paragraph for me? Or walking 20 steps in 20 seconds, and says whether she is fatigued easily, the shortness of breath at rest, or on exertion, or needs extra pillows to breathe well at night, right? Anemia can cause these problems as a result of respiratory changes made as adjustment to reduce tissue oxygen level. Cardiovascular assessment: with blood problems reduce oxygen delivery, the heart works harder. We spoke about that. Systolic BP tends to be lower than normal in patients with anemia and higher than normal when the patient has excessive red blood cells. So you have your systolic, your normal is 120/80. You're going to have your systolic probably 90, 100 when with anemia, and is going to be high when you have excessive red blood cells. Kidney and urinary assessment. Having said that, 120/80. Remember, if a patient is having 90 and above as a diastolic, there is problem with the ventricular, okay, with the left ventricular of the heart, okay. Kidney and urinary assessment. I'm sorry, let me go back. And that particular ventricle is the most important of the heart, the left ventricle, because it's the one conducting the pumping out of the heart of the blood. Okay, so you don't want your patients to be more than 90. You have to talk to the cardiologist. Kidney and urinary assessment. The kidneys have many blood vessels, and bleeding problems may have hematuria. Keep in mind that the adult with chronic kidney disease produces less natural erythropoietin and often is anemic. This is very important. So you want to go and check your kidney functions in your CMP, right? Your complete metabolic panel. CBC, complete blood count. CMP, complete metabolic panel. You can check your kidney functions there. Musculoskeletal assessment: rib or sternal tenderness may occur with anemia, blood cancer, when the bone marrow produces cells, increasing the pressure in the bones. So yes, we spoke about that the flat bones, the sternum, the iliac crest, and the long bones are the one producing, these cells. And in leukemia, it's very often to see patients complaining of flank pain, right? Because of the rib pain. It's very sad. It's very sad. And you give them analgesics and nothing seems to work with that type of pain. Abdominal assessment. The normal adult spleen is usually not palpable, but an enlarged spleen occurs with many hematologic problems. An enlarged spleen may be detected by palpation. But this is usually performed by the primary healthcare provider. Don't try to palpate the spleen, please. It's not your job, because an enlarged spleen is tender and can rupture easily. Nursing safety: do not palpate the spleen, we know that. A common cause of anemia among older adults is a chronically bleeding GI ulcer or intestinal polyp. That's why it's so important to periodically, as the gastro suggests, to do your endoscopy and your colonoscopy. If the ulcer is located in the stomach or the small intestine, obvious blood may not be visible in the stool, okay? Or such a small amount is passed each day by the patient and the patient is not aware. The higher the ulcer, meaning in the stomach or the jejunum, in the duodenum, the jejunum, okay, in the upper part of the intestine, the less blood is going to be noticed in the stool, because the blood somehow is going to be dry, and the stool is gonna hide this blood. That's why endoscopy is very important. Okay, and also your blood work, especially iron, to double check what's going on. Okay. Central nervous system assessment, vitamin B12 deficiency impairs nerve function, or severe chronic deficiency may cause permanent neurologic degenerations. They are patients that the symptoms are going to be, they are shaking, they are trembling. And some doctors are going to think that this is Parkinson, and it's not. Probably it's just a B12 deficiency. Some patients are gonna come with different states in their temper. They're going to be very upset sometimes, and they are or depressed, okay, or sad. And this could be a neurologic state. Many neurologic problems can develop in patients who have leukemia, because leukemia can cause bleeding, infection, or tumor spread within the brain. Having said that, always check your B12. It's not, I am going to the pharmacy and I'm going to start taking B12 by myself, 1,000 milligrams per day. No, B12 cannot be in excess, neither in deficiency. B12 needs to be, must be within the range. Okay, that's B12. And usually try to get B12 in the higher end. We're going to speak about pernicious anemia soon. Psychosocial assessment, diagnostic tests, venipuncture is necessary, apply pressure to the site for at least 5 minutes. If the patient especially has history of thrombocytopenia, test of cell number and function. And that's good to know, right? If you have a patient that is having a problem with any type of blood, you have to apply pressure. A peripheral blood smear is made by taking a drop of blood and spreading it over a slide. That's how peripheral blood smear is conducted. Complete blood CBC includes a number of studies. As I mentioned, hemoglobin HGB level is the total amount of hemoglobin in blood. The CBC can measure other features of the RB, the mean corpuscular volume. Okay. Measures the average volume or size of individual RBCs. So the RBC cells, the mean corpuscular volume means the amount of volume of the cell, right? And it's useful to classify anemia. If the volume, if the cell is big, more than normal, then it's called megaloblastic anemia. And the megaloblastic anemia are two types only, B12 or folate. So when the cells is having the mean corpuscular volume big, is megaloblastic, either B12 or folate. When the MCB is decreased, the cell is smaller than normal, is microcytic, as seen in iron deficiency anemia. A good way to remember this is, that's the way I study. Microcytic, the second letter is I, micro, iron deficiency anemia. Okay, so you have your megaloblastic, you are going to remember this, B12 and folate, and as default, microcytic, the I of iron is because the cell is small, the MC, the volume is small. The mean corpuscular hemoglobin is the average amount of hemoglobin by weight in the single RBC. So if we have a small decreased value in the volume, of course we're going to have less volume of hemoglobin, right? The MCH is going to be small. The mean corpuscular hemoglobin concentration measures the average amount of hemoglobin by percentage in a single RBC. When the MCHC is decreased, the cell has a hemoglobin deficiency and is hypochromic. Okay, so you have two terms to remember. One is megaloblastic and the other one is microcytic. Megaloblastic, remember, is the volume that is big on the cell. Microcytic because the cell, cytic, micro, is little cell. Iron deficiency is little because the iron is low, right? And then you have these terms that are related to the color. So it's hypochromic when there is less hemoglobin, right? So iron deficiency anemia not only is microcytic, but also is hypochromic, okay? Because the volume of the cell is small, therefore the hemoglobin is going to be small. Um, these three tests can help determine possible causes of low RBC counts that are not related to blood loss. Reticulocyte count is helpful in determining bone marrow function. Um, it's an immature RBC that still has its nucleus. An elevated reticulocyte count indicates that RBC are being produced and released by the bone marrow before they mature. So the reticulocytes are the baby RBCs, are the baby. So if we in trauma, when a patient is having trauma or excessive bleeding, the amount of reticulocytes are going to be high, okay? And these are not mature cells. An elevated reticulocyte count is desirable in an anemic patient or after hemorrhage because this indicates that the bone marrow is responding. Of course, if you have a patient with anemia of a trauma, you want to see that reticulocyte high because it means that the bone marrow is working, right? A platelet count, also known as thrombocyte count, reflects the number of platelets in circulation. The normal range is 100 to 400. Some laboratories, they said 150 to 450. So here you have the table. You can review the table. And that's good to know. You need to memorize your average. How much is the average in percentage of the RBCs, platelets, and WBCs? Okay. And platelets, patients who have values between 40 and 80 may have prolonged bleeding from trauma, dental work, blah, blah, blah. So you have here all the types of tests. The COMS that is testing direct and indirect and used for blood typing. Also, you have the serum ferritin, transferrin, and the total iron to measure iron levels. Also, the transferrin test measuring bleeding and coagulation. You have your proton beam, PT, reflecting the level of clotting factors. And I am going to give you a hint. For example, when we work in the hospital starts with H. H equals to heparin. So we need to pay attention in the hospital. Heparin, how much is the value that we are looking for, and that's good to know, as I say here. Warfarin is for home, right? And I'm going to supplement a file with a table that is going to help you with that. But you can remember all these, the PT, PTT, and warfarin levels in this paragraph. Another question that is, yes, is questioning the, okay, it's asking you, when reviewing the laboratory result for a patient in emergency department, which finding does the nurse report immediately to prevent harm? So we're gonna report the 5.2 because INR should be between, depending, it could be 2 to 3, 1 to 2, depending on the condition of the patient, right? Imaging assessment. So you have the radioisotopic imaging. That is going to be in a similar machine where we conduct the MRIs, okay, and they are going to inject fluid, IV. Then you have the X-rays to diagnose some hematologic problems, and also for the radioisotopic imaging, this link is going to be in the file that I'm going to supplement for lecture 36 and 37. Bone marrow aspiration and biopsy. There is a video as well that you can see. The most important of bone marrow is we need to consider the informed consent and obtain this before the procedure. Okay, that's good to know. Patient preparation. So you have to tell the patient that anesthetic injection will feel like a stinging or burning sensation. We're talking about the bone marrow. Tell him or her to expect a heavy sensation of pressure and pushing while the needle is being inserted. That's why I strongly suggest you to watch the video. Usually the iliac crest is used for this bone marrow aspiration and biopsy to be performed, and that's good to know. Okay, it's not the sternum. Okay, in rare cases, most of the times we use the iliac crest for the bone marrow. Nursing safety priority, aspiration or biopsy procedures are invasive and sterile technique must be observed. After the procedure, apply external pressure to the site with hemostasis is ensured. Until hemostasis is ensured, a pressure dressing or sandbag may be applied to reduce bleeding. And that's good to know. In real life, we apply pressure 5 to 10 minutes. That's good to know. 5 to 10 minutes to make sure no bleeding is going to happen, right? Follow-up care. You have to check prevention for excessive bleeding, cover the site with a dressing after bleeding is controlled, and you have to use your ice packs over the site to limit bruising, and to be careful in the first 24 hours, maybe 36 hours. I would also recommend to double check on fever, but it's not all the time. So here you're going to have the mastery questions. Also, I want you to check. You can find the answers as I showed you before, right? And basically also review the questions from your PowerPoint. Okay, question from your PowerPoint. So we cover all the topics. And basically that's it for chapter 36. Thank you guys for your attention.